Welcome, everybody. I'm Lee Nasahi with Vision Serve Alliance, its president and CEO, and we're thrilled to be presenting this webinar today. Many of us had the good fortune to hear it in Scottsdale at our conference. It was so good, we knew we had to give you all the opportunity to hear it again in a webinar. So it is my pleasure to introduce our presenters, Dr. Pris Rogers and Dr. Carlie Rhoads. These two women are aging and vision loss experts. And what do I mean by that? Well, while they have the academic and research background, bar none on this subject, they're much more than that. They're practitioners, they're doers. They want to see the needle move. They want to change the environment, the circumstances, the opportunities for older Americans living with vision loss. Everything they're doing is working towards that. So this presentation, the Aging and Vision Loss Revolution, they're not kidding around. They want a revolution. Let's see what we can do to help them. I want to just take a minute to clarify something. I've had a few people say something like they understand Vision Serve Alliance is no longer involved in aging. And that is false. I think perhaps that misunderstanding came about when last year, facing limited resources, we were seeking a new home for the Aging and Vision Loss National Coalition. We were never abandoning aging. That's a primary focus for us. And in fact, what we did is choose a few very big issues and projects within that space and are working intensely on that. That includes the big data project, the meta-analysis, the alternative funding training, and OT training. All these things are to enhance opportunities for older Americans living with vision loss. And the coalition is still administered by us. We had a restructure, nobody's stepped up to take it over, but we are so pleased, grateful that Pris and Carlie volunteered to administer this coalition, and they're doing the lion's share of the work. And they're looking for more volunteers, doers. We don't need just talking, we need doers, take action. So let's listen to their wonderful presentation, and then there will be an opportunity to ask questions at the end, and also a way to sign up to help them with the coalition.
Thank you, Lee. This is Pris. I'm going to start us off, and our title, as you can see, is the Aging and Vision Loss Revolution. But what we added to this from our presentation that we did before is it starts now, because we have to get it going. So why do we need a revolution? I bet all of you on this call probably know, but I'm going to go over a few key points. One is that we need to create a shift in the national paradigm related to aging and vision loss. We've heard the term ageism for a long time. Well, that goes along with vision loss as well. So we have a double whammy going on, and we do need to create a shift in that paradigm. And the shift is needed everywhere in all aspects of society. We also need the same old thing we talk about, funding of services, and we need personnel to provide those services. And another issue is public perception of older people who are blind or low vision, and then their own self-perception of themselves. And how can we reach them? Because often they don't think of themselves as blind or low vision. So we have to figure out what's the appropriate messaging to get to them. Another reason for a revolution is integration of services to ensure that people who are blind or low vision get the help they need to live independent and productive lives. For example, we need to involve the aging and healthcare networks, and we haven't. We've worked on that for years. We still have a lot of way to go in that arena. Finally, to meet the existing and future needs of the ever-expanding population of older people who are blind or low vision, and many of those, as we have found from the big data project that we have worked on, have comorbidities such as hearing loss or diabetes. So what I wanted to do to start us off, though, is to think, what have we already done? What's our past look like, to kind of give us some perspective on stuff? Well, first of all, for those of you who don't know, the Rehab Act authorization and funding was initiated as a pilot in 1975, so 50 years of us trying to get services going. 50 years, just think about that. It was authorized at $5 million in 1986. And in 1986, Congressman Roybal actually held a hearing. I don't know how many of you know about that, but even John Cruz, who's been involved a lot in our big data project, was involved in that hearing. And so we were glad to have that because it sets the stage and it got things going. And so, for example, I have a quote from a woman who was involved in the hearing. Her name was Emma Wyckoft, and she said, "I'm able to live on my own due to services I received from the Oregon Commission for the Blind. I had to go to a residential care center due to my loss of vision, but I didn't like it there. I had no freedom and I had no privacy. I wanted to leave, but my vision had gotten even worse and I didn't think I could manage." So she went on to talk about the services that she got through the state of Oregon. And one of the representatives asked her, "What would your life have been like without the independent living services that you received?" And she said, "Nothing. I would have nothing. Maybe they would have put me back in a care center or a nursing home. I just don't know." So that tells us why we're here today, doesn't it? Because of what she said back then, and that's all still true today. So as we go forward, finally we got some formula funding of $13 million in 1992. And what that meant is that we finally had money for every state. At 13 million, you can imagine it wasn't a whole lot, but at least it was a formula for every state. Now, many, many, many years later, we have our funding all the way up to almost 34 million, and it's been stagnant for over a decade. So it's really critical that we find some of the champions like we had before, like Congressman Roybal, Senator Hatfield, and then later Senator Graham in Florida. So that's the kind of thing we are really looking for, and we'll be talking about that a little later on. In 1997, AFB started the first national agenda on aging and vision loss. And we had goals that related to funding, personnel, advocacy, employment, and public awareness. Do these kind of resonate with some things you've been hearing about? So that's what we had back in 97. Then fast forward to 2016 when we started the 21st century agenda, again under AFB. And at that point, we were working trying to get something going with the White House Conference on Aging and some recognition of our field. We didn't get very far. However, we still worked on goals related to funding, professional services, collaboration across service delivery. Talked about that a minute ago, didn't I? And funding for low vision devices. And then wonderfully, in 2019, we were able to start the Aging and Vision Loss National Coalition under VSA, as Leah's talked about. And that's been a great place for us to be. And we had an opportunity to grow and do quite a bit. And we've had goals related to public awareness, data and research, policy and funding, access to services, and we've also worked on transportation.
Hi, this is Carlie. And while we were at the VSA conference this year, one of the conversations that we had with the Aging Revolution discussion group was talking about how can we collaborate better with others? Who do we need to get connected to? You know, really identifying who our stakeholders are and what are some things that we need to focus on with regard to those different relationships. Because we have this coalition and we have like this, everyone here in this call, I'm sure, passionate people who really care about the population of aging and vision loss. But we're not making a lot of progress. You know, like Pris just mentioned, the funding's been stagnant for 10 years. And, you know, we really have to start thinking about, okay, how can we start making some progress moving forward? So the first stakeholder identified at the conference was the senior care facilities, and things that were talked about specifically with senior care facilities, that training is needed, specifically that includes incentives, follow-up, and coaching, that we need to consider the education levels and different cultural needs of the staff at these facilities. We need to think about how we're going to address issues and support with things like staff turnover, lack of buy-in. The training, knowledge, and funding are really the key constraints here. And one quote that we captured from one of our participants was saying, you know, it's not that hard. You know, anyone can learn to do these things and support this population. So we felt that was really important to specifically call out and state. The next stakeholders that we talked about were Congress and RSA. And the main theme that emerged from this discussion of these stakeholders is that funding and advocacy for funding both need to be increased, that we really need to pump up our efforts and really be trying with this. Some issues that arose from this conversation included segmented partnerships, turnover, limits of structure and certification, and the fact that it all really comes down to funding and how very, very critical and important this is. Our next stakeholder was advocacy organizations, and we talked about needing more people supporting the older adults with vision loss population at a local and agency level. So top down and bottom up, really important that we're getting all of those areas. Constraints include a lack of inclusion amongst agencies and an inability to embrace change, such as with marketing strategies. So we talked a lot about how technology and social media has changed so rapidly and is continuing to do so, with the advent of AI and the constant changing landscape of social media. Probably just a few years ago, Facebook was really the main vehicle, but now things are swiftly changing and branching out into other areas, and a lot of agencies and organizations aren't keeping up with that. There's a need to train people to advocate in the right way, and I will put a little plug that a couple months ago, Pris Mark Riker and I did a little advocacy webinar. So there are some resources and tools out there about how you can get involved and advocate. And there's also a need to be sure that we're setting clear priorities. So we need to make sure we know what the message is and everyone's on the same page. The next stakeholder that we talked about was VR. So some things that came up in this conversation, we're talking about proper intakes, adequate and appropriate follow-ups, and connections for funding are all the really critical pieces. But then some really important questions came up about who's going to do this, who will fund this, how are staff going to find the time to do these things? And also we need to consider, what about older adults still in the workforce? Because again, population is changing and people are tending to stay in the workforce and actively working at later ages these days. So that's a consideration that needs to be made. We need research savvy, time, and diversification of funding opportunities. We need to consider reactive versus creative. So we need to get more creative, less reactive with our funding and training. And big priority, priority, priority. If we put time, money, and resources into it, then it needs to be a top priority. So really being meaningful and purposeful about where we're putting our time, resource, energy, efforts, and funding, and following through with things. And I'm going to pass this back over to Pris.
Thank you. And like Carlie said, we really have to be efficient about what we do. And as we get toward the end, we're going to be talking about some ideas that we have about our North Star goals that will keep us efficient. So before we get into that, though, we wanted to talk a little bit. We don't want to all be negative. We want to talk about the wins we've had. And I personally want to thank the VSA members and staff, and also my cohort, Carlie, for the support that we have going on with this whole program. They've just been great. And also the Suvkoff Goldenberg family has been supporting the chairmanship of the committee, and they've donated $5,000 in 2024 to keep us going. So I just want to shout them out because that's important. And as you heard before, VSA was struggling, and so we're so proud to have that funding. And we can use more, by the way, hint, hint. Other things, we do have a national service delivery system, as I talked about before. It's underfunded and understaffed, but it exists. And I can remember when we first got that started, I was so excited because I thought, now we can finally say that every state has something. And we couldn't say that before. So we have to celebrate that. Now, thanks to the Big Data Project, we have population data to support our ask, and we know a lot more about the people whom we're trying to serve. We have the OIB TAC that provides ongoing support for the OIB programs, and that program is written into the Rehab Act, and they just got funded again for 5 years. Yay. We have a data research collection related to aging that, by the way, is at the OIB TAC on their website, and our groups worked on putting that together. And we have an advocacy plan and an accessible platform, the Speak For platform, through which we can advocate for services, as Carlie was talking about. And we're going to talk more about that in a minute. A few more wins. We have a great group of committed leaders through our AVL&C steering committee. We have a partnership with NCOA to get the word out to the aging community. And I just saw that something just came out yesterday of an article that was written through Vision Serve, and I think Lee's name was on it, but that went out through NCOA. So we're getting information out all the time to the aging committee. We started public awareness flyers. If you can't see something, say something, and that's in our resources on the website on Vision Serve Alliance. We have a seat at the LCAO table, and you may say, what's that? Well, that's the Leadership Council on Aging Organizations table. And the reason that's so important is because a lot of those people are really plugged in to what's going on in Congress, and they can help us and teach us about what's going on and give us some insights into things. So it's really great to be at that table. We have a toolkit for aging service providers that was put together by one of our goal committees, and we have a draft advocacy manual for older consumers that we need to work on, but we do have the draft. And as you can see earlier, we were talking about advocacy as a really important thing that we need to be working on. We have started Vision Rehabilitation Week. Sue Dratty's really worked hard to try to get that going with NEI. And then, of course, Lee already mentioned the things that are going on with the Medicare Exploration Project and the evidence-based vision rehab services research. We also they did some agency training with agencies on Medicare Advantage, Medicaid, and community care hub reimbursements. And now, of course, the pilot that Lee mentioned with occupational therapy integration. So where are we now? Well, we're at a crossroads and we're ready for a reset and for establishing the North Star goals that I talked about earlier and changing the script. At VSA, as Carlie's talked about, we heard from members about the need for stopping our siloed approach and establishing relationships with organizations that are outside our immediate bailiwick, including the framing of a business proposition with impact on business, finances for businesses is one way we may want to look at it. Also looking at language and messaging that resonates with those outside our field. Sometimes we use words that people don't know. And so we need to think about how can we rephrase things and put things into language that people understand. Taking responsibility at the individual level first. And I think we heard that loud and clear at the VSA conference, how very critical that is for us as individuals to first take the responsibility. And then, of course, going back to my favorite word, advocacy at all levels.
All right, this is Carlie, and this next little section we're calling pushing the reset button, because the loud resounding feedback that we're getting, from the coalition, from the professionals in the field, from the people of this population directly, is that we need to make some changes. We need to get some big things moving. We need to try to get some W's in our win column. We need to start making progress moving forward. So this is us officially at the coalition pushing that big reset button. So to do that, the coalition has been having a lot of conversations and thinking about, can we agree on messaging about what our guiding vision is? And to that end, of course, this is still a work in progress and in draft form, but this is what we've worked on and what we have with the coalition so far. And our guiding vision really boils down to this, and that is older individuals with vision loss and who may have additional disabilities will have their unique health, independent living, and related needs met by America's public health and aging infrastructures. So this is one sentence that really sums up, what we're all about with the Aging and Vision Loss National Coalition. This is our guiding vision. This is what we hang all of our goals and objectives on. And this is really what is our driving force for what we do. So I like to call this next section our North Star goals, because in my mind, these are the goals that serve basically as our North Star. This is what will guide us. This is what will show us the path forward. This is what will get us that movement and momentum to move forward. And we really felt that this big reset is really important right now with the changing landscape of just everything right now, and trying to figure out where can we do the most good? Where can we help achieve some success? Where can we really support this population of people? So Our first North Star goal is around awareness and public will. And with that, we want to shift the national narrative from invisibility to urgency, empowerment, and dignity. We want public awareness campaigns. We would like to have partnerships with PR and media influencers. We want to equip consumers and professionals with toolkits and messaging. And I will say the coalition does have toolkits that they've made previously. We just haven't disseminated them yet. So we have some really great things and a great foundation to work with. So that's really promising. And we really want to hold networks accountable for collaboration. Our next big North Star goal is all about tangible systems change through public policy and funding. So one thing we'd like to do is advocate for Teddy Joy's law and related policies, and we will be talking more in depth about Teddy Joy's law in just a little bit. We want to expand funding for qualified specialists. We want to build evidence-based through research. As a self-described research nerd, I think that is so important. If we have the hard data to back up what we're doing, what we're advocating for, then it makes our position so much stronger. We want to translate research into policy briefs. We want to push for Medicare, Medicaid recognition and coverage. And we also want to create no wrong door service access. Another really big North Star goal for us is all about data research and promising practices. So the heart of this is to use research data and emerging practices to drive change and accountability. So something that our data and research committee has done a beautiful, amazing job with is collecting a lot of articles for this great database that Pris mentioned that's hosted on OIB TAC's website. And this is a great, amazing resource where peer reviewed. So all of us on the committee had a rubric and a stringent process where we reviewed these articles. So these are high quality peer reviewed articles that have the stamp of approval that this is really good evidence-based research. So we have this research base. So now we're thinking about, okay, what are the next steps? How do we move forward now that we have this great database? We want to think about standardizing referral tools and screening protocols. We want to make sure we are always promoting best practices across providers. We want to build a national data backbone for investment and innovation. We want to make a push for regular CDC and Healthy People 2030 vision data. We want to promote outcomes tracking and vision rehab. We want to strengthen the workforce through training and cross-sector models. And we want to identify and share promising practices nationwide. So with all of that in mind, those sound like great goals. I think all of us here on this call could probably agree, sounds amazing, great. So, okay, what's next? How do we make that happen, right? What are our next steps? So that's what we're going to be talking about now. So to that end, the feedback and discussion that we had at the VSA conference was amazing. That was such a great gathering of minds, a great group think. And I wanted to really emphasize some of the overarching themes that came from those discussions and connections. The first one is empowerment and visibility. So talking about how we can make older adults with vision loss a recognized priority in aging healthcare and disability sectors. Also, collaboration and accountability, leveraging partnerships, demanding shared responsibility, and tracking impact. And then our last theme is innovation and scalability, promoting and replicating promising ready-to-scale solutions across the US. So in our mind, these North Star goals, the guiding principles of the coalition, and then these themes that emerged from VSA have all been considered and put together to kind of help us set up a plan for what's next. So within our organization, really thinking about it, we can look at segmentation of services such as billing. How do we do this? How can we make it better? We can empower individuals to obtain education, create, disseminate, use training toolkits. We need to collaborate. If there was one word that I had to pick that was the focus and the main theme, it was definitely collaborate. We need to share interagency information, best practices, and really come together as one entity that's on the same page. We also want to advocate and spread the word about vision services. So that's within our organizations, right? These are all great things that we can do. Now, across the industry, we can get people to be on public policy committees and really push to have a seat at the table. This is where really important conversations are happening. And I know Pris is going to kill me for bringing this up, but this is such a great example. So Pris really pushed here in our state of Tennessee, where she and I both live, to get a seat at the Tennessee Public Health Authority. And because she did that, had a seat at the table, and was able to bring notice and recognition to vision loss issues. Now, when they have their annual conference, they have a whole track just for vision loss. That is amazing. Like, people are having these conversations, they're having panels, they're having discussions, they're making connections. And in my mind, that just means, more research, more advocacy, and it's such an exciting possibility. But if we don't have a seat at the table to make these discussions happen, then we're not going to make any progress. Across the industry, we can also advocate to increase funding for OIB. We want to tap into the stories and experiences of older adults in political office. And I know we keep saying this, but we have got to find a champion for us. Like, if we can't get some buy-in from someone in office that can support us in our mission and what we're doing, we're just going to keep banging our heads against the wall and not making a lot of progress. And something that's really cool with the Speak For platform that you heard Pris mention is there's a tool embedded in that where people can share their stories and take like little videos and things like that. So we really want to, welcome people, to be part of these campaigns and to really make their voices heard and share their personal experiences and stories. Because at the end of the day, the whole reason I feel like we all are here, and I know specifically Pris and I, and the reason we volunteer our time to work with this coalition is because we are so passionate about this population and we want to support the people of this population. Across the industry, we can also find strength in numbers. So we need to combine to make sure we have a larger voice and platform. I'm going to let Pris talk about this because she knows a little more about the background, but this is where we're going to talk specifically about the Teddy Joy bill that I mentioned briefly a couple slides ago. So Pris, take it away.
Thank you very much. So what we're working on, a lot of our advocacy is focused around this Teddy Joy bill, which we put together a couple of years ago, but we really hadn't had the platform that we do now through the Speak For to really push it. So the idea behind Teddy Joy is to eventually update the Older Americans Act to infuse throughout the text formal recognition of older people who have vision loss and vision-related rehab services. Believe it or not, the Older Americans Act has absolutely no mention of anything related to vision. And so that's something that we feel very strongly needs to be done. Another part of it is to strengthen the independent living services for older individuals who are blind, the OIB program, by setting mandatory and more appropriate threshold funding levels, which would allow the program to keep pace with the cost of living. I talked earlier about the fact that the funding's been level for a while, but another major issue with it is that many states, I think it's 17, are only getting $225,000 a year as they're called minimum allotment states. And it's because of some of the language that's written in on how states can get funding based on the population. So that's a major problem. And there's really no cost of living written into the program either. And one other major issue is having to meet the match, which is 10%. And some states are having problems with that. So a lot of the things that we've been talking about with this advocacy is to fix all that. Another thing is to bring together all the federal authorities at the national level to with the national consumer and service providers to develop and implement a whole of government strategy to make sure that older people with vision loss can effectively navigate and get access to what they need, whether it's technology and services, transportation, you name it, it all needs to come together. This almost happened this last year. We actually had somebody at the table, but then the Older Americans Act didn't reauthorize, and lots of things happened in Washington, as I know you all know about. So there's nothing written in law that brings our services into focus with all the rest of them, and that's really critical. Another thing that's not on this slide, but we need to put it here, is that Teddy Joy also includes putting an office on aging and vision loss in the Administration for Community Living, which is what houses the Older Americans Act programs and the Centers for Independent Living. So we think it's really critical that that people who are older and visually impaired have that voice within the administration. So those are the key things that we're talking about with the Teddy Joy bill. And of course, we know that if we can get a champion to do this, we'll need to make changes, things will happen, but this is a start to get us going on what needs to be done to meet some of the goals that we've already talked about. So we're hopeful that those of you on this call will join us, that you'll take out your phone, that you'll use the QR code that we have on the slide, and we'll be sending the slides out later and you can access it. And the idea is that using the QR code, you can bring up the site and send a quick message to your congressional representatives. You don't have to write anything. All you have to do is just put in your name and your email, and the congressional representatives are already associated with your zip code once you put that in, and so it'll go to the right people, and it just takes just a minute to do this. And then it also, there's another slide that comes up that asks you if you want to do a video message. I think Carlie mentioned that earlier, but we're hoping that people will do these video messages because it's all about telling the story and just how critical these services are. You heard me earlier in the day talking about the story that Emma Wyckoff talked about it back in 1986. Well, the story's about the same, but we need different voices to bring that out. So you as advocates, get your consumers, everybody, anybody can tell the story. And so it's really easy to do it. So we hope that you will just go ahead and do this right now or a little later today. And Sue Dratty from VSA is keeping track of all this information. She's on the back side of the Speak Force, so she can give us the input on what really happened, how many people were how many people did it, how many representatives got the message, and then you will get in your email something back from your representative, and you need to follow up with that. Say, hey, I know you got this message. Now this is what you need to do, because then it'll be up to you to try to talk to the people in your own state once you get a message back. So we hope you'll do this. If you have questions, we have our email at the end, and we'll be glad to answer any questions that you might have about doing this, but we're pushing you right now. So feel pushed, okay?
All this to say, so we talked about like some goals, some themes, some things that we really want to see happen, but what's really ahead for us? And Pris and I just really wanted to talk about, collectively, this is kind of our vision for the coalition. This is what we'd like to see happen. And of course, there's going to take some detailed planning along the way to make these different steps happen. But we feel this is a great start for us. This is our reset, and then we can move forward. So we have our momentum started with research and feel there is a defined trajectory, but now we need to make it happen. We need better recognition of the population of older adults with vision loss and their needs. Funding, education, and advocacy are the cornerstones that we need to move forward and elicit greater participation and collaboration. So I want to say that again: funding, education, advocacy. So that's the little three legs of our stool that we really need to build and make it stronger and better. So our dream includes visual impairment services are deemed medically necessary, including durable medical equipment, that there is a playbook for senior centers and agencies that help outline success for this population, and that we welcome other partners to our industry and speak a common language. And these are actionable items in a vision that was kind of created together at the VSA conference with the Aging Revolution folks that got to be part of this discussion. But I think this really speaks to the greater needs of this population, that speaks to the things that we would like to see make happen. And I think by naming these things very specifically and explicitly, we know, okay, this is the page we're all on. This is the language we're using. This is our messaging. This is what we want to do and see and make happen. So now that we've defined this and we've hit our little reset button, now we have to put in the work and do the work to make it happen. So to that end, this is our shameless plug for all of you today, but we would love to invite you to be part of the AVLNC. So this is our be part of a national movement creating lasting change for older adults with vision loss. And this is great. Like, you don't have to, as much time or that you want to donate, or as much as you want to be a part of it, totally up to you. I mean, yeah, there's some pressure because we want people to come join us, but there's no pressure to be like on every single committee or to do all the things, or to give of yourself that you don't have to give. But there's lots of there's really a place for everybody. Like, if you have a specific interest, if you have unique skills and talents, like, we would love for you to come join us. If you want to be a big research nerd, come join our data and research committee. If you want to get involved with advocacy and policy, we have a committee for that. If you want to talk about our toolkits and how to disseminate those and other work in that arena, we have a committee for that. If you want to be part of the group of folks that gets together to, make sure we're accomplishing things and on the right track, you could be part of the steering committee. We have a place for anyone who's potentially interested. If you think you don't have anything to add to the conversation, I say you are wrong. We would love to hear your voice. We would love for you to be part of this. And I would love to share some of the kind of attributes of being a coalition member. So if you become a coalition member, you will get to collaborate with leaders and innovators in aging healthcare and vision rehabilitation. You'll get to shape policy and advocate for increased funding and better access to services. You'll get to share resources and best practices to strengthen programs nationwide. You will get to amplify awareness through coordinated public campaigns, and you get to contribute your expertise to drive research, innovation, and accountability. So, and this is not to say we expect you to come in and know how to do all of this right off the bat. Like, Pris and I are here to offer training, resources, guidance. Like, we're not just throwing you into the deep end of the pool and you don't know how to swim. Like, we're giving you some little floaties so you can swim with us. So we want you to come be part of this movement, that we want you to be part of our aging revolution, because it really is starting now. Like, we are making things go. Like, we are up and running, we are moving forward, and we want as many people with us to move forward with us and to make these dreams and visions that we've talked about tonight, like, to really happen and come true. So if you are interested and would like to talk about joining one of our committees or just being a member of the coalition, I have we have the coalition email up on the screen. This is the best way to get involved with Pris and I, and it's capital AVLNC at visionservealliance.org. And if you're interested in just like checking out, like who the chairs of the committees are, what the actual titles of the committees are, because I do not have that memorized. And you're just curious about some of the work that we've done, definitely go on the Vision Serve Alliance webpage, and that's www.visionservealliance.org/AVLNC. And there's definitely more information for you to check out there. But please definitely send us an email. Like, we would love to chat with you. We would love for you to be part of our group. We did want to open up some time, like, for some discussion. Like, we want to hear from all of you. Does this sound like a great plan? Do you think we're totally off base? We'd love to hear like some of your impressions, your opinions, how you feel about what we've talked about today. So some discussion starter questions that we have include: what are the biggest barriers to bringing about change related to services for older people who are blind or low vision? What immediate steps can we take to improve access and or awareness? What's one national policy or initiative that we should push forward through AVLNC? And if you envision what a successful aging revolution looks like, what steps need to be taken? And how can we get more people involved and engaged in our revolutionary activities? So if you want to unmute yourself, I think you can do that. Feel free to use your voice, or if you'd like to put something in the chat, that's also an opportunity for you. I'll take this opportunity while people are thinking to talk about a few of like the little steps that we've been taking with some of these initiatives. So we are thinking on both a locally and a national level to make sure that we're connecting with and getting the needs met like in our own communities, as well as more broadly with like big national advocacy efforts. So we did have our webinar about advocacy and the Teddy Joy bill a couple of months ago. So that's one big national thing that we've done in recently this year. Some other things that we've been doing is connecting in our local communities with like senior care facilities, rehab centers to talk about interest in training and dissemination of the toolkits that have been created about how to work with individuals of this population. We have one member of our coalition, Inicio Carrera, and he's been working with like local and AAA organizations and getting the word out that way. So there's definitely lots of opportunities to come join us and do these sorts of things. So even if it intimidates you to think about trying to do like a big talk at a conference, or you're not sure about, riding up to Capitol Hill to make a big impassioned speech, there definitely are other avenues and opportunities for you to participate. Some things that we've been talking about in the data and research committee include, how to keep adding more articles to the database, how we can get people more excited and interested in doing research, in this particular field, and those sorts of things. I do see a question in the chat, so I'll read that out loud. Is there a way to connect with grandchildren of older adults with vision loss? In my family, several of us would like to know what we can do to assist our beloved grandmother. There might be some interest in that age group. I'll let you start, Pris.
Well, I think it would be awesome if we could get someone involved with the coalition who has that interest and could help us maybe get some ideas together, because grandchildren, not only can they personally assist, but they can also assist with a lot of the other things we were talking about. And in that way, we can start to grow our movement. And that's been a concern that I've had for a long, long time, is we need to get others involved, people outside the field, people who have a connected interest but don't know what to do. So I, for one, would love to talk to you about your ideas, Brenda. So thank you for bringing that up.
Yeah, Brenda, if you wouldn't mind putting your email in the chat, I will reach out to you after the webinar. But I think this would be absolutely amazing because where I live in Tennessee, I've definitely cultivated a little group for myself of older adults with vision loss. And I've been doing like little impromptu like tech classes where like they come bring their cell phones and they're like, Carlie, I broke it. Can you tell me how to fix it? And teaching them how to do things like navigating medical portals on their computers or their phones, because, like we talked about earlier, that technology piece has changed so rapidly to the point where sometimes when you call like a doctor's office, you can't get a real live person on the phone, and you have to figure out, how to navigate the phone system. And then if you get a message from your doctor, it comes like through a specific portal and you have to know how to get into that and those sorts of things. So there's a very steep learning curve, but this is definitely a group of people that want to learn and be able to do things independently and enjoy like their independence and a high quality of life, and be able to get connected and be involved in the community, and all the things that have real ramifications in terms of like mental health and those sorts of things. So I think that's really, really important. And I'm so glad you brought that up, Brenda, because that would be a great way to get involved like locally, like with this population of people. And I would love it, if we could, have a group of people that are interested in connecting and like spreading the word about this and those sorts of things. So I'll definitely be reaching out to you, Brenda. Thank you.
We do have Neva has her hand up. She would like to make a comment or ask a question. Hi, Neva.
Hello, Helen. Thank you. I am particularly interested in helping to dispel the belief among older people who are experiencing vision loss, as well as their families and the general public and the medical personnel they encounter, that losing vision is not a death sentence. It is overcomable. There is hope. There's help. And so many people don't know that. The pharmacist doesn't know that. The nurse practitioner doesn't know that. The daughter, son, grandchildren don't know that. And it's particularly heinous to me to have a population of people who are blind or have low vision, who are living full and productive lives, and yet people who are losing vision later in life don't recognize that they too could do what those of us who are already blind or have low vision before we get to senior years are doing.
This is Carlie. Neva, I 100% agree with you. One thing, so I made a connection with the coalition with another group of people that are currently in the beginning stages of creating some trainings for medical professionals, like specifically ophthalmologists, about how to have these conversations about vision loss and, you know, be supportive and encouraging, you know, of these situations, instead of just being like, oh, hey, you're going blind, good luck with that, and you know, those kinds of things. So that is definitely something that's on our radar, and I would like to see us do more with it for sure. And because I think there's a lot of opportunity for us to partner, you know, with universities, with students who are going to work with older populations or become medical professionals that work with these populations, or you know, there's lots of opportunity. And what I've been learning from other folks who've been attempting to do this is you get better traction if you can catch them before they leave school and get into the professional field, where they get really entrenched in how they practice and how they feel about things. So I think, you know, the coalition having a goal to do that kind of advocacy and get that kind of training out to people would be really great.
We do have some more questions. Jason, were you going to go ahead and?
No, I was just going to say, if you wanted to, I would just wanted to make sure people knew that there were some questions in the Q&A. So Helen, if you want to read one or two of those before we wind up.
Yeah, so the first question here is, have you connected with the Age Friendly Communities Initiative?
This is Pris. I've been involved with it some here in Tennessee. We almost every health department has worked on becoming an age-friendly community. And also nationwide, there's a lot going on. The Hartford Foundation has really worked on that whole concept and is now thinking about trying to bring vision into the whole landscape. And one of the things they have done is worked with CMS to get the 4 M's into the hospitals, which means medication management, mentation, and what matters. When a person's in the hospital, to assess them, to ensure that all those things are addressed. Unfortunately, they don't necessarily address vision. So that's something that we will need to be working on with them and really pushing. But yes, I think that's a really great way to go, because there's just so much going on, and environmentally, you name it, the age-friendly community thing is a really good force for us to really look at working with in a lot of different arenas. And thanks for bringing that up.
All right, we have another question in the chat. This is regarding number 4 on the discussions starters. And she is wondering, what is the conversation around making sure that medical, including mental health, information and medication is accessible for adults with low vision and blindness?
I do think this is Carlie. I do think this is something that we could do a better job with for sure. But I do know of one resource that is that has been created and is available on the American Foundation for the Blind's website. It's a series of modules that talk about it's for people who work in medical settings, like all the way from cafeteria workers to receptionists to medical professionals, about how to appropriately be supportive and of individuals with vision loss. And it's a video series. It doesn't take long to get through. There's like quizzes and handouts. So that's one thing that's available for folks out there. but I definitely, and I also saw that Nick said in the chat that at the Prevention of Blindness Society in DC, they host an annual event for ophthalmology medical residents in DC hospitals to learn about how low vision happens outside of the exam room, and it's very hope oriented. And to me, this just highlights an issue where I feel like we have these little pockets of people who are working on all of these things, but there's been no unification of all of us to come together and be like, oh, cool. So you're working on that on the West Coast, and this is on the East Coast, and this is down South. And, you know, you have these little pockets of people who are doing really cool things, and not everybody knows about all of this. So, you know, in my mind, you know, again, that word collaboration and how important it is really critical for us, because, you know, we need to know what everybody's doing. You know, if somebody's created a resource or a toolkit or a training, I mean, absolutely, like, we need to know about it. So, you know, in our mind too, like with this coalition effort, like, it is to bring everyone together. You know, like, if people are doing, you know, cool, amazing, wonderful things, like, you know, we want to hear about it. And, you know, those are things that can be, you know, highlighted and shared with people. And I think that's really critical with that collaboration piece. I also saw Kira talking about one of the biggest barriers to bringing about change related to services for older people with vision loss is the continued stigma in society that people with vision loss can't do things and therefore they cannot be independent. And she suggests possibly doing a campaign to highlight what older people can do with vision loss to increase awareness. I think that's a brilliant idea, and I definitely wrote it down to add onto our list of things to discuss at our next meeting. So thank you, Kira.
And I think we had one more comment from Sarah Chatfield, and this was regarding number 1, about the biggest barriers to bringing about change. She said, I think there's a general sense that grandpa has lost his vision and all people lose their vision if they live long enough. And that's not the same sense of urgency around addressing independence and quality of life as if there's a younger person who is blind or acquired a vision loss.
This is Carlie. I think that's a really great point, because what I think is really interesting, I'm a TVI by training, and I've worked as a TVI. And, you know, they say, oh, we serve the whole spectrum, but then it's specified birth to 22, and that's not the whole spectrum, right? And I do think that, you know, people do just assume like, oh, you know, you get older, you start losing your hearing, you start losing your vision, and people are just kind of expected, I think, to suffer in silence. So I definitely think more awareness needs to be brought to it. Again, like what everyone is talking about and emphasizing is so important, you know, to let people know that just because you're losing your vision doesn't mean your life's totally over. It's not. Like, you can learn the skills and be independent and do all these great, amazing things. And it just takes advocacy and awareness and making sure, you know, people have training and access to resources and, you know, all these different pieces. So I think this all definitely fits with our North Star goals. It fits into the themes that we've been talking about. And these are definitely things that are being noted that will be part of conversations. And if you had a note, a question, or a comment, I would love for you to come be part of the coalition and continue the conversation with us.
It's Jason. So I think on that note, we're going to need to close. So let me do that if that's okay, everybody. I'm Jason Eckert, the Chief Operating Officer for Vision Serve Alliance. So much outstanding conversation has just occurred. And of course, in questions and answers, right when we get going is usually the time that we have to stop to be respectful of everybody's time. I wish to make just a few summary comments that were reflected in what Pris and Carlie said, and then some of the questions. I too really wish to encourage folks that if individually, because of your profession or you're a practitioner, you just have interest in this particular topic, you're working in any community, if you wish to participate in AVLNC, all that's required to do that is to just send an email to one of the people on the top of your screen and ask to start participating, and then bring issues forward, like the issue, for instance, that Neva brought forward. That's absolutely one way to go, and we really welcome that. A second piece that's important is some of the folks who were identifying things happening here were identifying my organization does X. Your organization, you as a representative, can also be part of AVLNC. That's not dependent on being part of Vision Serve Alliance in any way, but I really will encourage that if there is an organization out there where your organization is actively working towards something, the networking that would go on an organizational level, on a not-for-profit management level, on a board governance level, on a whole host of clinical research and not-for-profit management things that occur with Vision Serve Alliance, I really would recommend that you consider membership in Vision Serve Alliance, so you have access to all things, not just the things that are identified through AVLNC. So please join one, please join both if you are in the position to do so. We work very hard to do exactly what Carlie and Pris were talking about for AVLNC and what comes through at some of our conferences. We work extraordinarily hard to break down barriers between silos at Vision Serve Alliance, be it disability policy in the broader sense, aging policy in the broader sense, be it recreation policy in the broader sense, transportation policy in the broader sense. The answer to Neva's question is the only way that folks living with blindness and vision loss can be out in the community is for us to, wait for it, be out in the community, to have all those opportunities to participate in the community equally the way our sighted counterparts do at any age. Specifically in this context for folks who are living with vision loss who are older, but at any age as well. That's what being part of a coalition like AVLNC or a membership organization like Vision Serve Alliance is all about. So I really encourage that. One more small plug, if folks are interested in this and they wish to simply support AVLNC because of the chairmanship sponsorship that Pris identified, there is opportunity to do that. You can support financially, specifically identifying this organization, continued research, development, management through VSA to do that. So please feel free to do that as well. And on that note, I really wish to thank Dr. Rogers and Dr. Rhoads for moving forward, for basically rescuing AVLNC and keeping it alive and happening. This is a breath of fresh air for AVLNC. We welcome it. We appreciate it. We hope you all get involved in it. And I personally thank both of you for making sure that a national agenda for seniors, for aging and vision loss, seniors living with blindness and low vision, is in the forefront of all of our minds and represented in all of these wonderful places. Thank you all for attending today. And again, thank you, Dr. Rhoads and Dr. Rogers, for guiding us through this excellent presentation this afternoon.